Hello, we are Group 10 and the purpose of this presentation is to educate legislators on the current opioid addiction crisis and what role physical therapists can have in ending that crisis. Over the past 2 decades, the United States has seen a dramatic rise in the use and misuse of opioids. Currently, it is the most widely prescribed class of drugs in the United States. An estimated 245 million prescriptions, not including refills, for opioids were dispensed in just 1 year. We also have research that shows that 1 in every 4 people who get an opioid prescription will develop an addiction. Opioid overdoses killed more than 47,000 people in 2017. These statistics alone should be a wake-up call that something has to be done to address this issue. While opioids are an effective method to mask the symptoms of pain, they do not treat the underlying root cause of the pain. Physical therapists attempt to treat chronic pain by using proven conservative methods that treat the source of the pain, as well as educating patients on the psychosocial issues involved with chronic pain. We are here to help end an ever-increasing crisis. We know that we can provide alternative methods to treating chronic pain, methods that do not result in devastating addiction and that have proven results when it comes to addressing patients with chronic pain.
So understanding pain is a really big role that physical therapists have in treating patients that have chronic and acute pain. One way therapists help their patients understand more about their pain is by informing them about the neuroscience behind their pain. So neuroscience is a study of the nervous system, which is your brain, your spinal cords, and all the nerves that go throughout your body, which are related to your pain. Chronic pain is elicited because of a nervous system issue and not a tissue damage issue. So most people think that they have an injury and that injury just hasn't gotten any better and that's just why they're still hurting, but that's not typically the case. So when we educate a patient on the underlying cause of their pain, they have a better ability to understand their pain, they're able to function more efficiently, and have less pain ultimately. Studies have confirmed that pain pathways are changed by factors that are not related to the stimulus of pain itself, but such as negative or positive emotions and emotional states. A lot of people don't know that their pain can be aggravated by stressful situations that they're put in, or unfamiliar situations that they're put in, or things such as that. When patients begin to understand that their emotions actually impact their pain, they're able to control their pain by calming themselves in stressful situations, by yoga exercises or breathing strategies or other things that we as therapists can teach them to deal with stressful situations. Our obligation to our patients is to educate them about their pain and inform them of all the options that they have available to deal with their pain and make informed decisions for themselves.
So now that we've talked about how physical therapists can educate a patient about their pain and decrease their pain, we want to talk about patients being able to access physical therapy. In Mississippi, you have to go to a doctor who would then write a referral that would allow you to go to a physical therapist. In the U.S. as a whole, 20 states allow total unrestricted access. 28 states allow direct patient access with some provisions, and 3 states have limited direct access, Mississippi being one of those states. You as legislators have an opportunity to increase the public's access to physical therapy. And with direct access, we could address the problem of pain before opioids are ever involved, and that's called a primary level of prevention. Physical therapists are highly educated in managing acute and chronic pain, and if we were given the opportunity, we could dramatically impact the fight against opioid use disorder. So we've talked about physical therapists and how they're educated in pain and opioid use disorder. So now let's talk about what they can do to prevent it. In the previous slide, I talked a little bit about primary prevention and how it focuses on patients who are in pain but who aren't taking opioids. So for this population, we can educate them on their pain so they better understand it, as well as the addictiveness of opioids. Another thing we can do is advocate for health insurance reform to make physical therapy available at a lower cost. We just want to be able to provide conservative treatment that's affordable. Secondary prevention focuses on people taking opioids but who don't show signs of opioid use disorder. In this population, physical therapists perform screens and interviews to make sure our patients are taking their opioids as they were prescribed. We screen for early detection as well as risk factors that are associated with addiction. And lastly, tertiary prevention targets patients with opioid use disorder. In this population, we communicate with prescribing physicians to let them know what we found in our screens, as well as addictive management so they can get the help they need while we provide our evidence-based treatment. Another thing is support groups for people with opioid use disorder or who have had it in the past, so they feel like they aren't alone and can talk about their experiences together.
While PT is a preferred treatment option for chronic pain, many patients do not pursue this non-pharmacologic route due to limitations in patient access. PT is more expensive and less accessible than opioids due to high out-of-pocket costs, copayments, and limitations in the number of visits covered by insurance companies. Although physical therapy is more expensive than opioids, many could argue that it is actually the cheaper, long-term option for pain management. Patients who attend physical therapy are more likely to develop better overall health and pain management strategies, as well as require less follow-up treatments in the future in the form of opioid prescriptions or surgical interventions. We as student therapists hope to increase awareness about the benefits of physical therapy to both our patients and our legislators who promote the physical therapy profession. We thank you for your time and hope you choose PT in the future.